I'm going to speak about. Appreciate the offer and the invitation, and I'm going to speak about Colorado Care Amendment 69, as well as more general problems with healthcare services in the United States. And I thought some background was appropriate because maybe a lot of you don't know me. But I'm a practicing physician. Actually, I'm mostly retired now, but I was a practicing physician, and I have some political creds. I've been the president of the Boulder County Medical Society and on the board of directors of both BCMS and the Colorado Medical Society. And I even ran for office on the Libertarian ticket back in the early 00s.
Thank you.
For county coroner, which I can talk about sometime. I view myself as a South Park libertarian with a small L. I'm not particularly interested in politics, so I view it as more a philosophy than a political party. But I'm also a skeptic. I belong to several skeptic organizations. And I have a musical side known as Dr. Reptile, which we won't talk about today. Now, my personality and my specialty within medicine allowed me to see problems coming from top-down controls. And I was fairly well known in that I went independent quite some time ago in my surgical practice, such that I could do everything in my office, and I gave up all third-party payers, including Medicare, Medicaid, and insurance. So I was operating completely on a direct patient pay basis. So I've seen how this works, how relations with patients and what you're going to do and their choices work outside of the what I consider the government controlled system. Let's see,
Go ahead. Go forward.
did it go forward?
No, I was on. That was my fault.
Okay, here we go. There's very little science in economics. This is more background stuff and assumptions. But there are some principles, and one of them that's relevant to healthcare is that wage price controls and taxes and mandates lead to market distortions, shortages, and black markets. What we're seeing is the increased cost of medical care, shortages, and attempts by doctors to operate outside the system is caused by these controls. And this is very much like public schools versus private schools. Your public education is supposedly provided for you, but if you don't like it, you can go outside the system, but you have to pay for it directly. I need to go ahead.
Go ahead.
Okay, so these are what I view as key elements or basic principles. And the first one is that healthcare services are not a right. If you think that healthcare services are a right, you are not going to go along with, agree with, or have anything to do with what I'm saying. Healthcare services are not a right because you don't have them inherent, and government is not protecting those rights. If you have a right to health care, the government gave it to you, and they're going to have to force the provisions for that supposed right. It's really comparable to any other services out there. There's really nothing fundamentally different about medical services versus other services that are considered important or essential in the economy. Another one is that insurance is not coverage. This is a big mistake that's made. It's like the primary example I give is that if you thought your groceries, which are essential, are going to be covered by insurance, that is not going to work, and insurance is not intended for basic needs and wants. It's to cover things you don't want to happen, to cover things you don't expect to happen, and it's to cover things that you couldn't pay for if they happened because you've spread out the cost and the risk. But it's not appropriate for basic coverage. The other one is that healthcare services are a very personal and important choice and should not be directed by, controlled by some third party, particularly the government. Okay.
My fault. Go ahead.
Some other principles. One is that my concept of socialism is that it's the idea that someone in a religious-like way knows what's best for other people or for society, and will then be happy to use government as the power or force to make that happen. And that's what we're seeing in medical care services. Colorado Care is an example of just that, a government monopoly deciding what you need and what you can have and how that's going to be paid for. Another interesting example is that I find that the proponents of I saw this at the Boulder County Medical Society, the proponents of Colorado Care don't like things like Tabor because that takes away their control of taxes and things like that. And the reason is because it's an amendment to the Colorado Constitution. But somehow that's okay for Colorado Care. Next. The other problems basically are using third parties to pay for your needs and wants. And again, this is like if you had a third party decide or to pay for your groceries, very quickly they would decide what you can have, how much, and you would have very little control over it because you're not paying for it. So we need to understand the problems and distortions in our current system that are caused by government. Now, when I was in residency, this was back in late 70s and early 80s, I saw health care delivered at the VA hospital in both Denver and San Francisco. And although there were some good people there and it wasn't completely bad, shoddy care, you could see the effects of government control. The prime example was at night when you were on call. You go to the call room and all the staff that was on at night would be in there trying to figure out how to work their pension or how to get some deal through the government, and the youngest person was the one that was out on the floor actually doing the work that was required. And I saw people who were eligible for VA but refused to go to the VA, found some other way to get their health care. And this is back over 30 years ago. Another one is that we don't see problems like we're seeing in medical care services in things where the government's not involved. Some prime examples are basic dental care, cosmetic procedures, which is what I was involved with, and things like LASIK, where the cost has gone down, not up, and people are in control of what they want and what they need. So the response, what I call black markets, is people, doctors or providers, trying to operate outside the government-controlled system. Now, single payer is something you hear a lot about. A lot of my liberal friends think single payer is a great idea. It sounds very nice until you think about who's the single payer and what that means. The single payer is government, and it's a monopoly if they control all aspects of it. And I can assure you, if, say, all your medical care that you provided out there was through Medicare or Medicaid, you wouldn't like the fact that it's single payer. Colorado Care is like Medicare, or actually Medicaid, or the VA for everybody. And that's the best way to understand it. It's basically socialism with monopoly control.
Okay, sorry about that. Go ahead.
Okay, so the basic point is that the current problems we have are caused in the medical health sector are caused by government and the use of third parties and insurance. So it's not like we have a free market system now and we're talking about going to Colorado Care. We're talking about a heavily controlled sector of services already, and then the problems from that are going to be solved by a government monopoly. And that's basically how these people view it. If your only tool is a hammer, all the world looks like government. Government will solve all problems and couldn't be the source of the problem. So Americans who can afford it and caring physicians that want to provide services will find ways around this. That's what a black market response to wage price controls, taxes, and mandates amounts to. The problems that we will have will be over things like the government control of licensure. You may lose your license if you try to operate outside the system. And the other one is hospitals or intensive care, because government controls hospitals which have intensive care units. It will be very difficult to provide those services outside the system. Did it go?
Yeah, I don't know. Go ahead. Does it work? Yes.
There it is. So what it comes down to is I really don't understand how people can fall for or buy into socialist promises, which is basically what Colorado Care amounts to. But they continue to do it. Again, it seems to me like that's their only answer, their only solution. It's always government, more government. I mentioned the issue about people liking Colorado Care but don't like Tabor because it's an amendment to the Colorado Constitution. Colorado Care will be extremely difficult to alter or undo if it's an amendment to the Constitution. Even the governor is, from what I hear, is opposed to Colorado Care, and that's one of the major reasons he doesn't think it should be an amendment to the Colorado Constitution. So I think we should turn it down and let some other state do it and show how badly it works. Now, these are some basic issues about Colorado Care and what it promises. I saw this. We had a seminar or a talk on this at the Boulder County Medical Society, and the pro people talked about some of these things, and one of them is they say, well, we'll just cover all providers. Well, they also decide who's a provider and who isn't, and you will find a lot of alternative medicine and other people that want to get on the bandwagon covered as providers. This issue alone is one reason why I think there will be big problems, because like Obamacare, any predictions of how much it's going to cost are just ridiculous. There's just no way that it's going to be what they say, and they're also depending on federal funds coming in that may or may not materialize. So the fundamental problem, as I say, is the use of insurance and health care services as a right. So what will happen, as I mentioned, is the doctors will retire or leave the state or try to operate outside the system, none of which are going to do very well for Colorado. I'm fortunate that I was already outside the system. I'm now mostly retired, but we need new doctors coming along. So, as I say, this will be relatively easy to provide medical services that are non-hospital outside the system, like private schools, but it'll be difficult for some things. Now, this was, I wanted to give my response for, let's see here, yeah. Okay, this was proponent claims for Colorado Care. I had a whole write-up of this and responses to it. So the first one, I wrote, "That sounds nice. What if there is no one willing to be a provider that the patients trust or wants? With free competition, you can always find someone willing to provide service, but not when the service is completely controlled." For the second one, I call this Santa Claus economics. It's basically promise anything and don't worry about how or who's going to pay for it. We, meaning the proponents of Colorado Care, we know what's good for you. We will provide. We will decide your wages and benefits. And start by defining comprehensive care. This is deeply socialist to think that everything can be provided effectively for free. This would be like saying you have insurance coverage for your groceries and you will have comprehensive groceries without cost barriers. This never works in the real world. Okay, the next one. Again, it sounds alluring, but it's still the equivalent of the government in terms of control. When the government says they're going to take care of you, you should run away if you're a provider. And the last one there, this sounds good and is the reason many otherwise intelligent people are in favor of single payer. But it's also misleading in that supposedly simplified single billing system is a monopoly and will eventually become evident that the supposed gains were not worth the trade-off of a monopoly control. And this, the first one here, did it
move forward?
Did it move?
Go ahead. Did it?
Yeah. Okay, the first one, the response, everyone is covered. Everything is covered. It will be better quality and it will cost less or save money. Right, you can count on that. The next one, malpractice litigation is largely to make money for contingency fee lawyers who support the political regime. This is more pie in the sky for promises the providers have no way of assuring. I would say, however, that as government takes over medicine more, it will be harder to sue City Hall. So some aspects of malpractice litigation will decrease. And fourth one, the medical profession will benefit from an emphasis on wellness, etc. These are buzzwords with no real meaning in objective reality. They are typical government socialist promises. So last week it was brought up to me, well, what's the alternative? And that's a very good question. And unfortunately, there is no alternative in the sense of a system that works better, because system is the problem. System is someone up here deciding how this should work and forcing it on everybody, when services, the demand, the type, all the aspects of services need to come from the bottom up. So that's a very difficult concept to get across, and once we've become dependent on government, as we are in a lot of areas, it's very difficult to undo it. It'd be like getting rid of Medicare. So there is no simple alternative except to say that Colorado Care would be even worse than what we have now. The other one I hear all the time is the equivalent of, if it weren't for government, we'd be dying in the streets. Well, if you're a statist and you believe the government is the answer to everything, that's how you think. But people actually can do quite well on their own under stable rule of law, and for getting medical services would definitely fall in that category. So it's going to be government medicine versus alternative or outside the system medical care, and you better start looking for how you're going to get your health care. I'm not sure what you're going to do again for emergencies or true insurance coverable type things, but for basic medical care, you're better off to start looking around for someone that can provide what you want, what you need outside the system. I mentioned some books. I haven't read this last one yet, but it looks very good. The first chapter, the first section of Steve Forbes' book on Reviving America is excellent. Lee Heeb I've met. She's an orthopedic surgeon, and she's got it down on Obamacare and medical care problems, but boy, she goes off the deep end on alternative medicine as a way to deal with getting around controlled medical care. But at least the first section of her book is worth reading. We haven't gotten to that yet.
Yeah, right. We'll get to it.
Okay, so that's it. How are we doing on time? Can we do some Q&A?
We can do some Q&A. Hadley, I'm going to try and get Skype working so that we can actually hear you during the Q&A. So I'm going to hang up on you on Skype and then call you back about 10 minutes. Is that okay? Or as fast as I can try and establish a Skype connection. I want to say thank you for your patience. I'm really sorry for all this convolutedness. So we'll talk to you real soon. Q&A. Is that microphone working? Please turn it on. There's a button at the top. Does anybody have any questions for Scott? So let's start with Kate, and then your name, sir?
Neil.
Neil. So Kate first, then Neil. Hold on one second, Kate. And then we'll have Lori. So Kate, Neil, Lori.
So the question I heard from my...
Hold on one second. I'm not getting... Is the microphone on? Is there a light on there?
Yeah.
I can hear you, but I don't know if it's going through the system.
I don't know why my microphone's not working. All right, if you can yell or
I can hear you, but
yeah, but if you could come up here and just talk to that microphone. Pardon?
Please repeat the question.
okay.
Okay.
All right, I'll repeat it as I understand it.
So the question that I get from some of my liberal friends is, what about those people with pre-existing conditions? It's really not fair, and this will fix that, like Obamacare fixes it. It's just not fair if people have pre-existing conditions to leave the system in place.
Okay, the question was about pre-existing conditions and how to deal with that. The liberals that you're talking about are the Colorado Care supporters and so on. Their fix is forcing, it's like wage or price controls, it's forcing services to be provided regardless of your circumstances. It's also using the idea that somehow insurance is to cover pre-existing conditions, which is impossible. If you have insurance, you can't cover a pre-existing condition. It's already happened. That's like getting insurance for your roof being blown off when it's already been blown off. So there's no insurance solution to that problem. Basically, that falls into the potential category of safety net, which is always a problem or always an issue, but it's still better handled by private charity and voluntary services than it is by government force or government medicine. So the answer is that should be handled the way other needs of people are handled in the private sector.
The next person was Neil, and then Lori.
It's more of a statement, but I think it would be beneficial to the group if you could go over some of the ways.
He's fine.
If you can go over some of the ways in which they're going to be financing this this horrific amendment, and it's really just insane what they're proposing.
Okay, the question was about costs, real costs, not pie in the sky or what I call Santa Claus economics. As we just saw with Obamacare, cost predictions are ridiculous. Basically, the solution to all costs out of control is more controls and more taxes. And there's a TV ad going on now that details some of the taxes and how that would affect Colorado. It would put us in the highest income tax in the country, and my guess is that still wouldn't solve the problem. And then again, it would be very difficult to control or undo that because Colorado Care is an amendment to the Constitution. So it would basically take another amendment to the Constitution to undo it or to try to control it.
And what about the taxes on pensions, and or are there any proposed taxes on pensions and 401ks and retirement benefits?
Well, the legitimate use of taxes is to pay for legitimate services of the government. But when you're talking about illegitimate services, then it's whatever we can tax is fair game. The other reason for taxes is social engineering. And so a lot of taxes are used to try to put down or suppress something, like taxes on tobacco or something like that. So either way, you're talking about more taxes, and it will be very difficult to control or undo them.
I just
Hold on one second, Lori.
That's okay, I can repeat it.
It's okay. I'm trying to get it to work. Okay, close to your mouth, Lori.
First of all, going back to the discussion about it's not fair for people with pre-existing conditions, I want to make people aware that in the state of Colorado, we used to have an insurance coverage that was called Colorado Cares or Care Colorado.
Cover Colorado.
Cover Colorado.
Yes.
And in that way, if you were declined by a major insurance company, then you could get coverage through Cover Colorado, and you were guaranteed to be able to get coverage, and it was tailored to meet your economic level, so that if you were, not making enough money, then it would be cheaper and cheaper and cheaper. And so that's something that we had in this state that we threw away, so we could have Obamacare, which really made it worse. It made it so that everybody is paying for the fact that other people have pre-existing conditions, and that the Cover Colorado was paid for by the insurance companies because it was beneficial to them to have a pool to put the sick people so that they didn't have to make all of their participants pay more to cover those sick people. For them, it was a plus, and for the people with pre-existing conditions, obviously it was a plus for them because they could get coverage. So, we had the solution here. I don't know why we thought Obamacare would be better, but probably because everybody thought Obama had the answer. And the other thing that I want to ask you is, do you feel, from what you've seen so far, that this can actually pass?
My political connections, as it were, are all saying it's not going to pass. I think, like tax increases and a lot of things, the people of Colorado are smart enough to realize that this isn't the way to go about it, and that it will go down. If you read the stuff that the Colorado Care people put out, it's all glowing, everything. But no, I think my impression from those I network with is that it will not.
My concern is
One
that,
second. Go ahead. Keep it to your mouth.
Sorry. My concern is the way that it's going to be worded. If it is worded so that just reading the top 2 lines sounds like a really good deal,
Yes.
then those people who don't read it.
Right. Well, the
Are gonna
devil's
say,
always
yeah.
the devil's always in the details, but I think people understand that I don't know that they understand about the monopoly part of it, but I think they understand the increased cost through taxes to everybody. I haven't even gotten to covering like illegals that are in the state. They're basically saying we'll cover anybody who needs it that's in the state, and all the providers will be paid properly and so on. I mean, it's just total pie in the sky.
And what's very frightening there is that we will end up having medical tourism, much
Yeah.
the same as
Oh,
we are
yeah.
currently having marijuana
Right.
tourism in our
Right.
state.
Well, that's why the costs are out of control, or would be out of control. It's, again, I use the example of if you had insurance to cover your groceries. Well, if you could have anything you want or think you need and someone else is paying for it, what do you think is going to happen? Uncontrolled spending, yeah. Now, and then of course they'll respond by starting to clamp down on it. Oh, no, you can't have that, or you can only have this much of that, or whatever. So it's to me, it's just typical socialist thinking that the government can provide this for you as a right and force it to be provided, and the cost will be taken care of by taxes. Another question down here?
Kate has some questions.
Doesn't this kind of system work really well in Europe?
That's another thing that you'll hear from, the question was, doesn't this work really well in Europe? That's another thing you'll hear from the proponents, and it really isn't true, but for some people, it probably seems like it's working. In Canada, we have people coming down to the United States to get their care because they can't get it in a timely fashion or what they want, which is, again, example of the black market. And my guess is that in Europe, there's a lot of that going on that you don't hear about. It would be the same if we had a safety net provided by, like, the VA. In other words, VA medicine for everybody who couldn't afford their own insurance or medical expenses or whatever. The people who benefit from that would think it's great, and the people who are going outside of it and refusing to be handled by government medicine, you won't hear too much about them. So I don't think it is working in the countries that it's supposedly working fine in. My answer to that is, well, then go live there. But was there another question here? Sir.
Go, Mike. Hold on one second. Mike, could you bring, could you give Mike the...
You mentioned in Lead Head and surviving a medical meltdown that she goes off the deep end with God's alternative medicine. Could you expand on that statement a little bit, please?
Yes. Neil and I met her. He's met her before and knows her a little bit better. And I heard her speak at this Doctors for Emergency, what is it?
Doctors for Disaster
Preparedness meeting. I relate to her a lot. She's similar age. She's an orthopedic surgeon. She knows what she's talking about in terms of the problems, but in my opinion, she used a solution to sort of your own medical care by using these what I consider alternative medicine or pseudoscience answers to things, and it's a little surprising and disturbing to me that she buys into that. Again, I'm a skeptic too, so I've been debating pseudoscience and alternative medicine for years. I do think that people should be free to choose alternative medicine as their therapy or whatever if they want, but they should have to pay for that directly. It shouldn't be then included in the what's provided for your right to health care, and we pay for it then, in effect. So I haven't actually finished her book completely, and I haven't had my debate with Neil yet about that. But I just wanted to warn you that the parts on the problems of Obamacare and medical care in the U.S. I thought were right on, but I don't agree with the rest of it.
I would like to try one last question. Go ahead.